but not really attracted more patients, right?
Okay.
So part of that, you go, hip hip hooray, everyone's healthy, right? Well, in a community that the age is older, probably people aren't coming. So of course, what you all said is we're not doing things right, so we got a lot of things to take care of. Financially, as we untangle this, I'm not sure we can deliver all that we had committed to at all those sites. Maybe. We're not quite clear yet on our current state, but there is a possibility that we're going to have to rearrange what we do at those outreach sites, especially in the short term.
At the Human Resource Council, we actually contributed $75,000 to get that particular clinic off the ground, because as you'll remember, the bus was going out there, and the nurse practitioner was now the sheriff. But anyway, so we saw the demand for it because it's isolated and it's kind of tough for people to, the winter especially, and if you're poor, it's really tough.
Yeah, we totally understand that. It's just what can we do with what we have, and hopefully we'll have a phase one, and then if we hit these, then this kind of thing.
And if the clinic and the hospital can't, I mean, we do have a group of nonprofits that are all cobbled together, and I
They can
am very
do
worried
service
about. Is it John?
John.
Yeah.
Jim.
Oh,
John
Jim.
was here.
Thank you. Okay. I am very concerned. A lot of my friends don't drive at night,
Sure.
Yeah.
or they only drive if their blood sugar is pretty stable.
Mhm.
And where I live in Alberton, we have friends helping friends, and people take turns driving places and things.
Mhm.
And I know that it's happening throughout the county, but it's not super organized, and I think we're gonna have to do, if that was to be taken away, we should, ethically, we need to have something.
Right.
And maybe-
How do we transition that
Yes.
if that becomes the plan? Yeah, I'm hopeful that it won't be total cut off, but I think there's got to be some changes just due to finances. But we will, I don't want that, everyone marches out and goes, oh, they're closing the clinic at St. Regis. Let me say it again,
Yes.
I am not closing the clinic in St. Regis.
There,
We are going to look at a plan.
one example of how we could keep something open but not have it come fully open would be, you can have blood drawn in a place,
Exactly.
but then it is.
Yeah, we talked about that.
Tested.
Right, we can have nurse clinics there. I mean, there's a
Right.
lot of
That's
opportunity
right.
there.
We've talked about that a couple of times.
Right,
That
that's
will-
good.
So just so you know how that really works, the hospital owns that clinic. They own it. At this moment in time, the clinic in Superior is renting that clinic and providing services 4 days a week there. We're paying the hospital rent because they own that, right? So we're untangling that to make sure that we're doing that properly, that it's not this, that, and the other thing, and who's doing what, and so whatever happens there, right? To the public, you don't need to know that. You don't need to know who owns what and all that, right? You need to know how the service is delivered. But right now, we have to get our handle on the finances so that we can find out, can we pay a provider to be there? Well, we can't if there's only 2 people that come and it's 8 hours of provider time. We can't. Can we do it 3 hours? Maybe, but then we gotta, where does that come from? Do we take it away from here? How does that really work? Because again, 4,000 people in the county. It's beautiful. We live here because it is. It's rural. We know we don't live in Missoula or New York City. We know we're gonna have to travel for things. If I happen to get sick, I have to figure out how to do that. Hopefully, I live in a community where I can have that discussion with friends and/or family. If social services and faith-based services are there to help me, yay. If they're not, do I blame them that I don't have those services here? No. I get together with my community and figure it out. But we can't pretend like we have all this money and thus we can have everything on the face here.
Yes.
Right? We just can't do it.
We had a clinic in Alberton at one time, and it was very unsuccessful. Most of those folks down, of course, that was many years ago, and it's a different population now, but
Not much.
most of those people all did their doctoring, they worked in Missoula,
Sure,
and,
Right.
makes sense.
all we got was the
Yeah.
druggies that didn't have any money, and
They don't even exist anymore.
Oh, no.
It's
Oh,
worse.
no. But it was not.
Well, actually, I think that came up when we were down there. Did you have a mobile clinic?
Well, Alberton,
No.
she was talking about
I'm
St.
talking
Regis.
about
Oh, I'm sorry.
Oh,
No.
She said.
oh, Alberton. Oh, I was on the St. Regis side.
Oh, I said Alberton,
Right,
I'm
yeah.
sorry.
Sorry,
We flipped,
you
we
got
But in
flipped. We
Alberton,
flipped.
Sure, no.
I think we rented space
Oh,
in
okay.
Alberton.
We heard they also had a
But we
mobile
had,
clinic at one
that
time.
time, we didn't have PAs, and we had to use an MD, and we
Yeah, we
had,
did.
we had three
Sure.
MDs here. And so we tried it, but it was not successful, and I
What
would
happens?
doubt
Spent
that
time at
the
the court.
population has changed that much.
Yeah.
It was not successful.
We're happy to stay longer. It's about 6:30. We're happy to stay longer, but we know people probably have other things to do in their lives, so. Again, thanks a million.
Yes, thanks for coming.
Thank you, Steve.